WHT Local Lifestyles continues.
For the past several weeks, we've been talking to our friends from the Vanderburgh County Health Department, and today we're going to talk about new parents who have so many questions about keeping their babies safe. And when it comes to sleeping, there are some pretty clear guidelines for infant safety. Community health worker Michelle Christian is here with public health educator Jennifer Healy. Welcome to Lifestyles, ladies.
Thank you.
This seems like such a simple subject, but what do young parents need to know, or parents or grandparents need to know if they're caregivers, about sleeping safe and babies sleeping safely?
There's so much that we talk about, like, in the classes. So the main things, like Jennifer will touch on, like the ABCs of safe sleep and things like that. And also, you know, the blankets and swaddling and pacifier usage, all those tie into what's needed for a safe sleep at night.
And we do hear so often about crib deaths and real issues that come up with having too many things in the crib. So what are the ABCs?
So, yeah, we go over the ABCs of safe sleep. The A stands for alone, so the baby should be in the crib alone. That means no blankets, no stuffed animals, toys, or bumper pads. B stands for back, so baby should be placed on its back for every sleep, including naps and bedtime. And then C stands for crib, so the baby should be placed in a crib on a firm mattress with only a tightly fitted sheet.
And there are still requirements now about the size of the bars in the crib. There are things to know, right, about that?
Yes, we review like a soda can test. The soda can test will let you know if the slats on the crib are too wide. So if the can fit through those slats, that means that the crib is outdated.
That would be an issue, I think, if you bought an old one, maybe from an antique store or something like that, because they're all sort of regulation now. Well, let's talk about how pre to 3 figures into this safe sleep program.
Yes, so as a community health worker, we do a safety checklist with the parents before and after the birth. So before the birth of the child, we review the sleeping area. So if the parent has concerns, or we have concerns that we have or we see, we can refer them to the safe sleep class to get further education on, you know, the size of the slats. You know, a lot of parents will get hand-me-down things, so we want them to be aware of the recalls and the size of the slats and things like that. So, and we also review no toys, no blankets, things like that, because they're going to get so many blankets and they're wanting the baby to be warm, but we educate them on body temperature, and the baby's going to be warm regardless of the blanket.
They have that good brown fat inside their body that keeps them warm too, doesn't it?
Yes.
I know it does drive you crazy to see the baby in there without a blanket, but it's just such an important thing. How do you connect, how do you get the parents involved in your class? If somebody's watching, they think, I want to get my family member involved in this, how do they do that?
Yes, they can simply call down to the health department and talk to Jennifer or I and sign a referral form. That's very simple, and there's two locations, either at the health department during the afternoon at Jennifer, or I'm at St. Vincent Wednesday nights at 5:30 till about 7:30. So it's not a long process. It's not a long class. Really
user-friendly. And let's talk about the survival kit, Jennifer.
Yeah, so we have to give incentives to try to get people to come to the class. So we give them the moms a survival kit, which includes a fitted crib sheet, a pacifier, a safe sleep sack that they can wear for the baby, and then it also includes a baby board book that they can read to their baby and understand, again, the importance of how they want their baby to sleep safely.
Well, girls, thank you so much for the hard work you do to make our communities and our families healthier.
Yes.
Pre to 3 program, lots of good advice and lots of good helpers there. Thank you.
Thank you.
We'll be back with more Local Lifestyles right after this. Stay with us.
This portion of Lifestyles is sponsored by the Vanderburgh County Health Department.